you don't know who Peter is, you're going to look him up on the web, but he is the world's most famous virologist, and he also happens to be a professor and a vice chancellor of the leading public health school in the world. Before we came on, I talked with Peter, and I gave him a copy of the questions, in part because English is your third language, Peter? Third language. And there's a lot to cover, so I asked Peter to make some notes, because we're going to try to go quickly and give short answers to a lot of questions. So why don't we start right at the beginning. Peter, how common are viruses?
Well, yeah, viruses are everywhere. It's a virus planet that we're living on. And it's amazing to see that all the viruses in the world weigh more than all living materials, animals, plants, and bacteria. So it's a virus planet.
So if it's a virus planet, I don't see any. How big are viruses?
Oh, they're tiny, and you can't even see them under a regular microscope. And you know, if you put 100 million viral particles of the coronavirus, can fit on a pinhead.
That's on a pin?
Yeah, that's how small they are.
So why is it called the novel coronavirus?
Oh, novel is just that it's a new virus that we've never seen before. And you know, our immune system has evolved over about 2 million years, but we have absolutely no memory, no protection against new viruses, and that's why it's so absolutely so disturbing.
So 2 million years is a long time. How often does a novel virus emerge that we as humans need to worry about?
Well, it's rare, but it happens regularly, from HIV, Ebola, all that, and it will happen again.
And how easily does this new virus spread?
Well, this virus spreads fairly easily from person to person, and so you get it from other people, and because it's a respiratory transmitted virus.
So how is it different from a lot of other viruses that, you know, infect us?
Well, you know, when you compare with other coronavirus, that's a family. A virus is a family, just like we have. Right. You know, SARS and MERS. First of all, many people who are infected have no symptoms for several days or sometimes at all. And so we don't know how to isolate. And that's really worrisome because you're infectious. Secondly, 80% of the time, you know, it's mild disease. And it's like, you know, we don't, like a minor cold or cough, and we don't isolate ourselves. And thirdly, the symptoms are often like the flu. And so we may think it's just you know, a regular flu. And fourth, and perhaps the most importantly, is that it's very easy to spread from person to person. And the reason is that the throat is full of viral particles. And that's how it's transmitted.
So how long before we can expect to have a vaccine?
Well, at least a year, I would say, and probably closer to 18 to 24 months. And let's not forget, you know, there's not even a guarantee that we will have a vaccine. I'm optimistic, but we have to test it. And let's not forget that like nearly 40 years after the discovery of HIV, that we still don't have a vaccine against HIV infection, despite, you know,
why does
billions.
it take so long if this is an emergency?
Well, the good news is that, you know, only weeks after the discovery, after the isolation of the virus, which was on the 8th or 9th of January, virus discovery, development started already, funding has been allocated, and, you know, lots of companies are working on it. But there are no shortcuts you can take.
Okay. So how deadly is the new virus?
Well, it kills on the average about 1% to 2% of people, as far as we know, but that's really not so useful to know for you as an individual. And on the average, what's most important is that 80% of the cases, it's mild disease. But in 20%, disease becomes more severe, requires hospitalization, and then a smaller percentage really requires intensive care when, you know, your lungs are getting really very much infected and affected.
So which groups, Peter, are at the most danger here in a simple way?
Well, first of all, older people like me.
And
I mean,
me.
I'm 71.
Yeah, okay.
And, you know, but also people with underlying diseases like diabetes, chronic obstructive lung disease and pulmonary disease, or cardiovascular disease or immune deficiencies. So they're at higher risk, and there the mortality can be as high as 10–15%.
And why are people with those comorbidities, those other diseases, why are they at higher risk? What makes that higher risk for them?
Yeah, because your immune system then poorly reacts to any virus, but particularly to this one. And that's when you have other health issues. And so it's particularly chronic lung disease, because there is also when you have, the breathing becomes more difficult, and so you need far more intensive care.
So it seems, generally speaking, children and young people are only mildly affected, if at all. Is that true?
Yeah, it's surprising, and it's actually one of a rare piece of good news, but it remains to be confirmed. But that's what it looks like.
Anything else unusual about this one?
Well, you can infect people even if you're totally asymptomatic and you're feeling fine, and that's really a problem. And new viruses are going to surprise us. Who knows what will come out?
So we often hear it compared to the seasonal flu, right? How does this virus compare to the seasonal flu?
Well, let's first say that the seasonal flu, it's not known enough, but the regular seasonal flu can affect 10 to 30 million people in the US.
Right.
And if only 0.1%, die from it, that's a lot of people. And worldwide, like in an average year, about 300,000 people die from seasonal flu. Right. And that's why we need vaccination. But we don't have a vaccine, or therapies for this COVID-19, and that's a big, big difference.
So how does the infection progress when a virus gets a foothold in your body?
Well, it usually starts with a cough. And then some fever, low fever, then it goes to higher fever, and then respiratory distress, in other words, shortage of breath, and then in some cases, it goes into very serious respiratory distress.
So at what point
pneumonia.
do people really need to seek medical care? At what point should I actually need care?
Well, when your fever is very high, and also when you have shortage of breath, right. And so that is really the big issue, just as for a regular pneumonia. It's not different.
So if this is less dangerous, than most other viruses, why are people so afraid of this virus, Peter?
Well, I mean, any new thing that can make you sick or that can kill you, I think is a cause of concern, of course, and makes everybody nervous. But I would say accurate knowledge is the antidote to fear. You need to inform, and there are good websites like cdc.gov or internationally WHO or your local health ministry or so. So that's what we should make sure because it changes all the time. We have to update our knowledge.
So has mankind ever wiped out a virus completely?
Oh yes, there is one, only one up to now, and that's smallpox, which used to kill millions of people.
Right.
And thanks to massive vaccination campaign. And we are very close to eradicating polio. Let's not forget what a plague that was in this country. Also, thanks to major efforts of the Gates Foundation and many governments in the world, including the US.
So if I get infected, are there drugs that I can take to make the virus less severe or maybe make it go away entirely?
No, unfortunately, not yet. No drugs work, but a lot are being tested in clinical trials.
So hopefully that'll change for the better. How likely are we to come up with therapeutic drugs that push it back in a good way?
Yeah, I'm quite confident that probably in a matter of a couple of months, we'll have repositioning of existing drugs against viral infections like HIV and so on. They're being tested in clinical trials, particularly in China, but also elsewhere. So we should know in a few months, and it looks promising.
What about antibiotics? Everybody always turns to them in a crisis.
Well, let's not forget, first of all, that antibiotics do absolutely nothing against viruses. That's for bacteria, and even if they're overprescribed. But they can be important when you develop, in addition to your viral infection, some bacterial infection. So antibiotics can have a role, but they do nothing against viruses.
In a hospital setting.
In a hospital setting,
yeah.
But like the common cold or the flu, forget antibiotics.
So we live in this socially connected world, and people are on the internet all the time. What about all the cures and all the great advice, Dr. Google and the rest of them?
Yes, well, there are, going to be, and there are already endless false alarms all over, and only when you read about it in trusted, reliable websites, such as the ones that I mentioned, CDC or WHO, should you feel confident that this is real science. But most of what you hear is really total rubbish.
Got it.
And so be careful and don't spread a fake news.
So How about masks? We see, masks we talk about. Are those blue surgical masks or the N95 face mask? Are those useful here?
They're very limited value, I would say. The most important thing is that when you are coughing, when you're sick, to wear a mask to protect others. But even the 95 masks that are pretty sophisticated, they only will block less than half of viral particles, to infect others. So that's not so great. But if you're sick and also if you work in a healthcare setting, then that's mandatory.
So the mask worn properly, and if I have the virus, or if I have sickness, or I have the flu, or whatever, wear a mask as a courtesy to others.
Yes, and that's really already a tradition since the Spanish flu 100 years ago in a country like Japan. So it's really altruistic. It's to protect the others. So please wear a mask when you start coughing and, the cold. Do that.
Okay. So is there anything I can do to truly protect myself from becoming infected in a global pandemic outbreak?
Well, let's assume that maybe 1/3 of the population will become infected. Right. And what we can do, though, is slow it down. And slow it down is really important, and that's by washing your hands frequently, wearing a mask, isolating yourself, stay home when you're sick, and so on. So we can slow it down and prevent it to a certain extent, absolutely.
So do different viruses spread more easily than other viruses?
Oh, yes. Measles is the worst. People don't realize that, but you can actually get measles by walking into an empty room that an infected person left 2 hours ago. And that's why we have these measles outbreaks when vaccination levels go down. It's very, very rare. The common cold also spreads fairly easily, a lot through hands, actually. But on the other hand, HIV is much harder to spread. And yet, we've had already 32 million deaths globally. So over time, it's also as bad.
So what will it take to stop this virus?
Nobody really knows for sure, but let's assume that we have a vaccine, and then it may take another 10 years or so, or more, of steady global vaccinations to stop really to get rid of this virus.
So how long will it take the new virus to spread through a population the size of the United States?
Well, in the absence of major measures, we know that it takes about 1 week for this virus to double the number of people infected in a population. And use this very simple math. That means that it takes 3 to 4 months to move from 50 infected persons to 1 million. That's the simple arithmetic of contagion. But that's, of course, the worst-case scenario, and we can do something to slow it down.
All right. So how many people, therefore, are likely to be infected in the United States, given what we know now?
Well, as of last week, only less than 500 people were tested.
In the whole United States?
Yes. And so I would assume, with the number of people who have died and so on, that there are, at this moment, there must be thousands of people who are already infected. And so we will know when we start testing more widely.
So how can a few thousand cases be hidden in our population?
Well, it's not so difficult with this, COVID-19, because, as I said, many people are asymptomatic. Many are mildly symptomatic, or many may think that they have the flu. So and people are not familiar yet with it. And there are no testing facilities, not enough of them.
So is a fever, or we see those thermometers all the time, a good way to identify infected people? What percentage of the people who tested positive in Chinese hospitals came in without a fever?
Well, about 30%, 1 in 3. So fever is imperfect. As I said, it's coughing. That is the #1 symptom. And so screening just for fever lets a lot of infected people pass. That's reality.
Might this new virus burn out like other viruses have seemed to do, Peter?
Unlikely. Unlikely, because it's already everywhere. Let's not forget that this is no longer a Chinese issue only. Over 60 countries now have cases. So it's well established around the world. Probably hundreds of thousands of people infected, China and elsewhere. So this new virus that, like influenza, that causes the seasonal flu, will probably be with us for a long, long time.
So is it likely to come back in waves, Peter, like others have?
Yeah, probably, although nothing is sure. But first of all, the Spanish flu 100 years ago hit the world in 3 distinct waves. And it was the second wave that actually killed most people, more than in the whole of World War I. But we don't know how this virus will behave. And for example, the reopening of factories and schools in China may lead to a second wave. And yeah, let's see.
So we know what the bad cases are. If we get lucky, what does being lucky look like with this one?
Well, warm weather may slow it down, although we don't know for sure. Or the new virus could mutate into something that is less dangerous with lower mortality, as happened before with the swine flu in 2009. But all this, I would say, I wouldn't count on it.
So how dangerous is that new virus for the high-risk groups? They really need to pay attention, it sounds like.
Yeah, well, it depends where you are in the world. If you are here, like in Boston, with super medical care accessible to hopefully lots of people, in a modern hospital, the death rate will be lower because there's intensive care, respirators, and so on. Although the risk will still be higher than for the regular flu.
So are you worried at all about it, Peter?
Yeah, if you're not in a high-risk group, although I'm in one, but then, I wouldn't worry too much. But everybody is eventually going to be at risk for acquiring this infection in the next few years. So be ready to stay home when at the first signs.
So if everyone is sort of at risk, why try to avoid getting it? Maybe people say, maybe I should just get it and be done with it, then I can go on.
Why not? But no, that's because if everybody would get it at the same time, the health system, society would implode for a while. So the key strategy is to, our goal is to slow down the spread of infection, slow down the number of new cases so that our hospitals, our health systems all over the world can handle the most affected patients without getting overwhelmed or turning away other patients who also need intensive care.
Yeah. So should everyone be tested as quickly as possible?
No, I don't think that makes sense. Once a few thousand people in a country have the virus, we will know from the symptoms that you have it, unless you're in a hospital where there is a real need to confirm whether it's flu or the new virus, particularly since I hope that soon we will have specific therapies. And then you need to have accurate diagnosis.
So it appears that people, after they recover from the virus, they could still be contagious? Is that true?
Yeah, that's been documented, but we don't know how frequent that is, and so more research is needed for that one.
So once you get the virus, is it like the measles or mumps and I'm permanently immune from the new coronavirus? Not my problem anymore.
Very important question, but we don't know the answer to it. And that's extremely important for the vaccine development, because vaccines, they count on, our immune response. So we haven't got long enough to see whether these are seasonal mutations, like with the flu, where you have every year you need another vaccine because the virus has changed.
So can this virus mutate? That's what you're telling me. What I'm hearing you say, it could be once one year, sort of like the flu, and then next year it's a new coronavirus?
Yeah, that's possible.
New coronavirus.
Yeah, novel new. Yeah, that's possible. We don't know yet. It's too early.
So I'm going to skip ahead a little bit here. Is there any chance, Peter, that this is one giant false alarm, and we're going to look back in the summer and say, wow, we all panicked over nothing?
Oh, definitely not. Definitely not. I mean, already over 60 countries have cases. Every day there are more and more cases, more countries. It's highly contagious. This is not a drill. This is the real thing.
So countries with modern healthcare systems will have much lower, death rates than countries that have very few hospitals. That sounds like a real recipe for problems. Is that what you're saying?
Yeah. So whereas here, I mean, death rates will be lower, thanks to hydration and respirators and so on. But it's going to be a giant problem when this virus invades Africa, with poor health systems and where there are no respirators and so on. So in the poorest countries of the world, it's going to be really a catastrophe.
So you're not terribly optimistic, is what I'm taking away here, Peter?
Well, in general, I'm definitely an optimist, but there's a lot to be very nervous about. And I understand that people have fears, and especially if you're in certain high-risk groups. But also the good news is that we're seeing progress in global cooperation, in science and medicine, more transparency, and very rapid development of therapeutics, for example.
So, Peter, do you have any final points that you'd like to leave the TEDMED audience with and the audience at the world at large?
Well, the first thing we have to be prepared for, and that is that please don't panic when in every city in the US, as testing is going to be widespread, and new cases, thousands of cases will be revealed. That's not because, it is getting out of control, but we shouldn't panic. Also, the US has had ample time for a head start to prepare for this epidemic, just as other high-income countries. And we should be grateful to China that they just slowed down the spread of it. So it's the low-resource countries that I'm very worried about. Secondly, of course, each death is a tragedy. When you say on the average 1% die, okay, it's a lot of people. 1% of a million, it's 10,000 people. But 99% of people don't die of this. And the seasonal flu, let's not forget, kills tens of thousands of Americans every year, and we don't panic. Thirdly, I would say, maybe a bit philosophically, but I think we will need to learn how to live our lives just fine with this new virus until an effective vaccine comes and until the next epidemic hits us.
So, thank you, Peter. That was a real tour de force, and sometimes just a clear set of facts really makes a giant difference. Is there any final message that you want to leave us with?
Well, I think we have to be realistic. This is a never-ending battle of humankind against viruses. Don't forget, it's a virus planet. But we are better prepared for the next epidemic when it strikes. That's really important for us, and for that we need to be absolutely committed to build a global fire brigade, I would say, long before the house catches on the fire next time.
Well, thank you, Peter. It was a real pleasure to have you on the TEDMED stage at this point in our world's history, and let's hope that the better answers are the ones that dominate.
Okay.
Thank you very much.
Yeah. Thank you.